BBC Radio Kent.
Let's go back to talking about GPs and the number of GPs per patient in some parts of the county. Karen Constantine is the deputy leader of the opposition Labour group on Kent County Council and a councillor in Thanet. Now, Thanet's one of the areas where, when we last had local figures, there were 2,500 patients on average for every GP. It was one of the 5 worst places in the country for GP-patient ratios. Karen, nice to have you back on the show. Would you say it is better or worse than that now?
I would say, from what I'm hearing and what I'm reading, that it's much worse than that now. I'm hearing from people who are really struggling to get GP appointments. They're going the extra mile, they're making all those phone calls, they're visiting the surgery if that's permitted, but they're still really struggling to get in to see a GP. And as we both know, that has a knock-on effect then on other health services. So anecdotally, I'm hearing that the ratio in Thanet might be as high as 1 GP for 6,000 patients in one particular surgery. Now, we've got our big meeting coming up in November, the Health Overview and Scrutiny Committee, and what I'm going to be looking for is the exact data so that we know exactly what we're dealing with. But we do know that demand is outstripping supply, as it were. We know there's far more people now that want GP appointments and need GP appointments than can access them. So that's kind of quite worrying for us all.
It is worrying. It's also worrying for the GPs, because I would think that you would become very quickly overworked, very quickly overwhelmed, possibly on the point of feeling that you can't do your job safely and satisfactorily when you have got that many patients per GP. It is not good for them either, is it?
Well, that's true, and obviously one of the things that GPs want is they want flexibility of how they work. But I mean, we saw this. We've seen this throughout the NHS. We've seen this, for instance, I know this very well with midwife shortages. If you have a shortage of midwives, then it creates extra pressure that leads to time off, for stress, etc., creating more pressure. It becomes kind of a vicious cycle, if you like.
Well, we've certainly been hearing about that among midwives at the Tunbridge Wells and Maidstone NHS Trust. Over the last week, a midwife spoke on the guarantee of anonymity to our colleagues at South East Today, saying they were doing 22-hour shifts. Nobody can sustain that, can they?
Yes, and with the best will in the world, no matter how much you put your heart into that role. Same for GPs, same for nurses, the same for other people working inside the NHS. There's only so much slack in the system. When that system is a person, something's going to break. So you've got to look upstream. You've got to say, how do we fill these vacancies? How do we fill these gaps?
Okay, let's talk about that exactly. How do you get more GPs to come and work in Thanet?
Well, I don't think it's just about Thanet, actually. I think it's a kind of Kent-wide or a country-wide issue.
Well, okay, but because this is BBC Radio Kent, I'm going to be bullshitting because you're on Kent County Council. Let's stick with Kent and the places in Kent where we know it's particularly bad. Clearly, you're going to make an argument that we need more GPs as a whole, but we also need to make certain places attractive to GPs, don't we?
Absolutely, but I think we've got to do a number of things. One, we've got to address these issues in the short term, so we really need to listen to what GPs are saying about what they need now, right now, to make their jobs tolerable, and we need to give them what they want. And that's not about cash or more payment, that's about the ability to work without that interfering with their pensions. That's a big issue for a lot of GPs, a sort of flexible retirement approach. But it's also about a more long-term or medium to long-term approach, which is we say to ourselves, how many GPs do we need and how many of those have we got in the system currently being trained? Because we can hope to fix the problem in the short term, but really across the NHS, I'm sorry, this doesn't apply to just Kent, it's about how we get more people into training, how we make it a more viable career for very many more people. And the shortages across the NHS are so severe now that it's really the only way forward. And that's why the BMA is calling for a duty to be put back onto the Secretary of State to ensure that this information is properly accessed and then acted upon. So somebody somewhere actually has responsibility for delivering on this. And in that way, we can safeguard our health right now, but also in the future.
What would you say the new Kent Medical School's role is going to be? And I realise this can't be immediate because they've only been running a couple of years and it's going to be some time before anybody comes through there and is a fully trained GP. But is this a positive story to have now a full medical training facility in the county?
Yes, it's a brilliant option for us, and it's something that we should be rightly proud of, and we should be looking to do whatever we can do. We've had this discussion before to get our local younger people into those professions, to encourage them, to assist them to go forward. But also we need to make sure that the students in training have sufficient support and have sufficient work placements. And that could be that they end up in GP practices or pharmacies, I'm not sure, or on the local hospital wards. And obviously what we need to do then as patients and families of patients is to be kind, is to accept that training is underway and to be tolerant of that, I think.
We're going to go on in a few minutes' time to talk about some of the words of Sajid Javid, the Health Secretary, at the Conservative Conference last week, about our own responsibilities and when we should step in to look after our own health and those around us. I don't want to push it too far, because I don't think for a second he was suggesting, as some people think, that we should be doing our own lung transplants, for goodness sake. But what do you make of this idea that we need to realise that we have resources ourselves, particularly caring resources, that we can look after each other before we lean on the state? What do you make of those remarks? Helpful or not?
Well, I think, there is an issue to do with what I would call medical literacy, which is, if you've got a headache, what do? Do you go straight to the GP? My answer would be, unless it's a really profound, massive change, you think you might be having something very serious, don't go to the GP, but try, a large glass of water, maybe sitting in a dark room, maybe taking a couple of paracetamol or aspirin or whatever it is that you can take as a starting point. And I think a lot of people have forgotten, some people have forgotten that we can do that. But equally, I arrived home the other night to find that my 17-year-old grandson had cut his foot and had kind of wasn't bothered too much about it, but it was still bleeding. When I looked at it, it obviously required a trip to A&E. So, on the one hand, you can say to people, don't worry too much and try to self-treat. And I think that's a fair point to encourage people to do that and take care of their own health. But equally, there are very often circumstances where people don't understand that actually their health is in danger and they do need to seek that kind of fairly urgent.
Okay, so I think that's a really good and valuable point to make as well. I wonder whether we are masking the problem as well by some people. I mentioned earlier on a very brilliant physio I know in the west of the county who said that she is absolutely run ragged. She's a private physio. She used to work for the NHS, but she said so many people now are coming to her because they know she's good. And to be fair, there are probably some bits of her work where she knows more than a GP, but they are coming to her because they can't get a GP's appointment or they can't get a physio appointment on the NHS, and that we may be even masking it because the number of people who are saying, well, I'll go and see somebody else on the, in the peripheries, in the sort of medical sphere, but not my GP and not a hospital.
Julie, I've been hearing for several years now about people that aren't going for the treatment that they need. We know that particularly men in a certain age group are loath to go to the GP when they need to go to the GP. I know of people that should have gone for GP assessment much earlier, and unfortunately that's been life-shortening. I know of people that have died because they didn't go and see a GP when they needed to. So, my feeling about this is always, if you're worried, go and see a GP. Sure, try an aspirin or paracetamol first, take those measures. But if something is repeating, if something is making you feel unwell, then the first port of call should be the GP. And again, when you talk about physiotherapy is incredibly valuable to people that have it. And again, it is in short supply. And again, it's something that we've privatised. So now people can't get access. In Thanet, they can't get access to a dentist, an NHS dentist. They can't easily get access to an NHS physiotherapist. It's like everything is in short supply. So every route you try is a dead end, and you end up kind of feeling quite desperate, which is when the A&E fills up, which is when 111 is called, and that's not helpful because we're adding pressures to the system where really what we need to be doing is alleviating those pressures. But it all comes down to workforce shortage. And sadly now, the only way of fixing that is a big fix, where we actually have a very positive recruitment drive, where we, get the bursaries in place, where we incentivise doctors, where we make sure that there isn't a trip up about pensions, triggering pension payments and making it not financially viable. And these are the things that we want to do. And the BMA is very, very clear about the steps that need to be taken. And we should be listening to them.
Thanks, Karen. Good to talk to you. Hope your grandson's foot's okay now. Karen Constantine talking to us about the situation in all of Kent and specifically in Thanet, where she says there is evidence, not for the whole of Thanet, but in some pockets of Thanet, that there may be as few as one doctor per 6,000 patients. This is BBC Radio Kent.